Good afternoon, everyone. Greetings from KIMS Hospital, Secunderabad. I am Dr. Neil Trivedi, Senior Consultant Urologist at KIMS. Today I am going to talk about the kidney stones, regarding why the stones happen, what are the symptoms of kidney stones, how we diagnose, and how we treat them. Next, please. So once the kidney is burdened with lot of stone load, then it may start failing over a period of time. And therefore, once stones are detected and it is confirmed that it may require some sort of management, whether medical or surgical, such treatment should not be neglected and treatment should be started immediately. Next, please. So the most important question in one's mind is how or why the stone formation happens. So there is a theory of saturation, that is when the urine is in equilibrium and when the crystals get dissolved in the urine, they usually pass away. But if there is a hypersaturation, that is the urine, if it becomes saturated, then such crystals would not dissolve and they will get precipitated in the kidney and thus result in stone formation. So supersaturation itself is not sufficient to form stones or crystals. If there are inhibitors, they will prevent the stone formation. Some of stones, that is the risk factors, are patients who are immobile, that is those who are bedridden, people who have got a sedentary lifestyle and they are not active, they don't exercise, and those who take low quantity of water, that is improper hydration, and those with previous history of stone formation. Next, please. So these are again the risk factors. The water which is high in mineral content, example the hard water. So therefore it is very important to either boil or use a water purifier. Nowadays RO water is freely available. So therefore it is important that either the water should be boiled or you should use the RO water. Dietary intake, which I'm so coming to the manifestation or the symptoms which the patient may have when there is a stone formation. The common symptom which everybody knows is the severe abdominal pain or referred to as the flank pain. The patient has a pain in the back just below the ribs. This pain is usually very severe. It can be associated with vomiting. It can radiate into the front up to the groin, and also there can be associated vomiting, and sometimes if the stone has been stuck for longer time, then the patients may also get fever. The frequency and dysuria is seen when there is a stone which is there in the lower part of the ureter. This can irritate the bladder and cause frequency and dysuria. Oliguria and anuria. These features may be there when sometimes the patient may have stone on both the sides, that is the both ureters if they are getting blocked, then it results in oliguria. Oliguria means passing of around 400 ml or less of urine in 24 hours. That is called as oliguria. If both the ureters are blocked, this presentation may happen. And rarely sometimes anuria, which means no passage of urine, a complete block of both the sides of ureters can result in this type of presentation. Next, please. So coming to the other clinical manifestation, apart from pain, there is passage of blood in the urine. Blood in the urine is seen when a stone in the ureter starts moving downwards. That might result in hematuria or blood in the urine. Sometimes even kidney stones or bladder stone can present as blood in the urine, but commonly hematuria is seen if the stone is there in the ureter and it is to push out the stone and the stone is obstructing and not moving there. Then slowly over a period of time, there is a swelling in the kidney happens. This is referred to as hydronephrosis. Next, please. Then, when the patient comes with these type of symptoms, and when we are suspecting that we are dealing with stones in the kidney or in ureter, then certain investigations are required. I will discuss these investigations one by one. The first one would be the complete urine examination. The complete urine examination is a very important tool in the diagnosis of the urinary stones, and the information which is available from the complete urine examination would be the pus cells, that is, if the pus cells are present or not, which means that because of the stone, the infection has come in the urine. Along with that, there is presence of either nitrite, sometimes presence of blood, and epithelial cells. So if nitrite is present, it means that there is an active infection in the urine because of the stone, and also blood cells will guide us towards the hematuria. So how severe the infection is there in the urine, also we can come to know with this urine examination. Next, please. The next investigation. Next, please. Next investigation is urine culture. The urine culture is very important to know that which organism is causing the urine infection, and when a surgery is planned, one should always do a culture so that the antibiotic appropriate to that infection which is sensitive to that, and that antibiotic should be started so that the post-operative infection will not happen, or it can be prevented to a large extent. So it helps in giving the appropriate antibiotic during the surgery. Next, please. Next. Ultrasound is a very important investigation, and it is many times available near the emergency room, because when there is a obstructive stone, it causes severe pain which is unbearable, and most of the first presentation by the patient would be in the casualty or in the emergency room, and there ultrasound can be easily performed wherever available. It is a non-invasive investigation and gives a lot of information regarding the stone. So it will give us information regarding the size of the stone, the site of the stone, and also whether there is any presence of hydronephrosis. So this information is very much important in going for the diagnosis and further planning of the treatment of the stones. Sometimes patients come with classical presentation of the pain which is there, pain in the flank, and vomiting also along with it, but they don't see any stone in the ultrasound. This happens because if there are ureteric stones, they cannot be detected on the ultrasound because only the kidney and the urine bladder are visualized on the ultrasound, but maximum length of the ureter cannot be visualized in the ultrasound. So when these type of patients are there, they usually ask that you are saying that stone is there, but the ultrasound is not showing any stone. So then in such cases, depending upon the clinical presentation, which is classical to the stone, and also the presence of hydronephrosis, which is the indirect evidence that we are dealing with a stone, we further need to investigate with a CT scan of the KUB region. So now the CT scan of KUB has become almost the first investigation or the investigation to detect any stone in the urinary tract or the KUB region, the kidney ureter bladder region. And it is very important for all the cases of stone. The CT scan is much more accurate and gives accurate information regarding the size and the site of the stone, which is very much helpful for the further management of stones in the urinary tract. Next slide, please. So I just to show here that on the right side you can see a dense white shadow which is there in the beginning of the kidney, and this is a large stone which is there at the pelvic junction, that is the starting of the ureter from the kidney. Next, please. This IVP has now become a historical investigation. Most of the times, the IVP was earlier done as a regular investigation when CT scan had not become very easily available. At such time, the intravenous pyelogram or the IVU, intravenous urogram, was routinely done for the cases of renal colic where we are suspecting the stone, for helping in the diagnosis of the uh, stones in the kidney, ureter, and bladder. But in intravenous urogram, as you can see, one injection is being injected into the body. So this injection is nothing but the contrast, which will help us to visualize the kidney, the ureter, and the bladder. So all these things can be visualized in a intravenous pyelogram or intravenous urogram. But the biggest disadvantage with this is that the contrast which is being injected to visualize the kidney and ureter, sometimes it has an anaphylactic reaction, and when it anaphylactic reaction is severe, it is very serious condition and it can sometimes also be fatal. So therefore nowadays the IVU is being avoided, has been almost replaced by the CT scan of the KUB where no contrast is required for the diagnosis of stones. Next please. So these are the other investigations. I have included CT scan here and retrograde pyelogram. Retrograde pyelogram is something which is done intraoperatively and it also aids in the um, surgical management of the stone patients. Other investigations of 24-hour urine calcium and all are done for the patients who are having the recurrent stone formations and other lab. Next please. So coming to the management of the kidney stones. So once we have diagnosed that the kidney stones, the management the bladder might have gone into the urethra and rarely sometimes we get an impacted stone in the urethra. So coming to the talk first about the kidney stones. Next please. So as I was mentioning regarding the size and site of the stones, so conservative management is limited to the stone which can be less than 5 millimeter in size because the width of the urethra is approximately 5 millimeter. So therefore a stone which is of less than 5 millimeter size can be managed conservatively. Conservative management involves, next please. So conservative management first is regarding the opioid agents, that is basically the painkiller or analgesic. These are used basically in the casualty, so or the emergency room. So when patient comes in a renal colic situation where there is a severe pain, the opioid agents, NSAIDs, they help in pain relief. Next, please. And the other techniques which are of importance in the management of stones is to avoid dehydration and also excessive hydration. So when we are doing conservative management of stones, we expect that the stone is going to get passed out in the urine. At that time, one should strain the urine so that you can come to know whether the stone has passed and send the collected sample for analysis, that is stored for chemical analysis. The other part of conservative management also includes some diuretic drugs when the stone is less than 5 millimeter in size, so that there will be more urine production, and along with that more urine production, the stone is also likely to pass out in the urine. Next please. Coming to the surgical management of the stone, that is when medical management is not possible, then the surgery has to be planned in cases as per the site of the stone. So suppose the stone is there in the kidney. These type of stones can be measured in different types of methods are there for removal of stones from the kidney. I'll start with the ESWL or the extracorporeal shockwave lithotripsy. If a stone is approximately around 1.5 centimeters and it is situated in any part of the kidney, which is the upper pole and middle pole renal pelvis, but not in the lower pole, then such cases can be managed with the extracorporeal shockwave lithotripsy. In this, there is a machine which has a focal point outside and a focal point inside is concentrated on the stone. So outside focal point is referred to as F1, where the energy is generated from the machine and that energy is transmitted, that is the shock wave energy is transmitted inside the patient, that is the F2 is on the stone. The energy of the shock wave will be get concentrated on the stone and thus the blasting of stone can be achieved. The disadvantage of this method is that the very hard stones, it is not possible to sometimes achieve a good fragmentation, and therefore there might be requirement of multiple settings. And also there is a disadvantage that the stones fragments which are formed that may not get drained out through the urine. Also it cannot be done for stones which are there in the lower calyx of. So these are the disadvantage of the extracorporeal shockwave lithotripsy. Next, coming to the PCNL, that is what I have written as percutaneous. There is a method of removing the stones when we make a hole inside the kidney from the back and then dilate it to reach into the kidney, visualize the stone directly and fragment it. In this nowadays we have got miniaturization, which is called as the mini PCNL. Earlier we used to do the routine PCNL, in which had little bit more morbidity. And with the advent of mini PCNL, the morbidity has decreased significantly, and sometimes we can even discharge the patient in 1 day. So this is a procedure where we directly go into the kidney from the back, see the stone directly, and make it into multiple fragments. Coming to the next procedure, which is called as the laser I have mentioned there, or popularly known as the RIRS, retrograde intrarenal surgery, where from the urine passage we enter into the bladder and then pass the scope, which is called as the flexible ureter scope, into the upper ureter or into the kidney to retrieve the stones. That means blast it with laser into very small powder, and this will drain out to the urine. After doing the blasting, we put a stent, and then the stent helps in the ureter to get a little bit widened so that whatever fragmentation we have achieved through laser, the stones fragment, they don't remain there, but they can easily drain out into the urine. This is referred to as the RIRS. And very rarely, when the stones are very large in size, then we may sometimes require open surgery. Next, please. Next slide. Next slide. Go one more forward. Next, please. It's the video which is not coming up. Next, please. Now, go back to where we. So coming to the stones in the kidney stones I was talking about, if the stones are very large in size, then we may have to go for a open surgery. The open surgery for the kidney stones, when they are large in size, involves the pylolithotomy, that is removal of stone. Next, please. Yeah, there it is mentioned. The pylolithotomy, that is removal of stones from the renal pelvis. Usually nowadays, almost we don't require to do this type of procedures. But if the stone is very large, for example, around 7 or 8 centimeters, then we may have to resort to the procedure of pylolithotomy or sometimes nephrolithotomy. Ureterotomy is the name of procedure where there are huge or large stones inside the ureter. Then we may have to open up the ureter and remove the stone from there. Cystostomy is the procedure when we remove large stones from the bladder, which are maybe more than about 5 to 6 centimeters. Otherwise, all the stones anywhere in the urinary tract can be easily tackled with minimally invasive procedures, which I just mentioned. Next, please. So now coming to the prevention, it is very important that we know something about the prevention of stone formation. Now the protein intake, which is usually restricted to 60 grams per day. So we have heard people saying that if there is a high protein diet, it can lead to stone formation, which is very much correct. But if it is restricted to 60 grams per day, then the likelihood of stone formation is very less. If there is a sodium intake should be maintained to 3 to 4 grams per day. It is also important to have the sodium intake because the sodium competes with the calcium for reabsorption. So if the sodium is not there, then the calcium may increase in the urine, and as you know that calcium crystals can result in stone formation. Next. So low calcium diets are not generally recommended because, as I mentioned earlier, unless it is a case of true absorptive hypercalciuria, and avoid oxalate rich foods like spinach, strawberries, rhubarb tea, peanuts, and wheat bran. Next, please. So, as I mentioned earlier, it is very important to maintain a good hydration, approximately a 2.5 to 3 liters of water per day. And also, one should be well hydrated during the night because, as you all must have observed, that when we get up in the urine, we are passing urine which is very thick, very dark yellow, This is a concentrated urine. So when the urine is getting concentrated or otherwise there is a dehydration in the body, the chances of stone formation increase. Next, please. So one should avoid activities which are leading to sudden increase in the temperature, excessive sweating or dehydration. Next, please. So if there are any questions, I'll be taking the questions. Next, please. So do take good care of your kidneys, and timely treatment for stone is very much essential so that you don't lead into renal failure. Sometimes we have seen cases where, in spite of stone removal being clearly indicated, the patients tend to get away from surgery because they are afraid. And once the stone remains there, then it can lead to the kidney failure. That is on the which side the kidney is, the stone is there. Slowly, over a period of time, the kidney can fail and stop working.